and that beneficiaries are receiving proper service and quality service, and you guys are trained to do so. And a lot of it comes down to that we help mentor you as you start getting your feet wet. We'll have somebody right with you, helping you out, and Tom will be working closely with you. That will happen where you'll catch on to a lot of things just by watching. So a lot of this is gonna be common sense knowledge, but we wanna make sure we're bringing it up and communicating. So we are asking all our volunteers to provide accurate, objective information related to Medicare, and it's important that you effectively communicate it and make sure that, once again, you know your limit. If you are like, oh gosh, that Medicare supplement stuff, don't even get it. Please don't try to explain it and confuse someone or misinform them. That's the last thing you want and we want and they want. So just stay within your boundaries. And every situation that you work with, you'll find is unique. You'll feel like I've done it before, or I feel like I have the answer right at the tip of my tongue, and then they'll say something that throws me into there'll be that exception. And there's always an exception in Medicare. So everything's unique, and please let us know and refer it on up the ladder to Tom or Dusty or I if you have questions or need to refer it that way. Okay, in this presentation, we'll talk about the 3 steps for effective counseling, tips for effective counseling, and what to say and what not to say. The first step, read them, be cordial, make a good first impression, do a little small talk, and explain what you do. This is what we're going to do. I'm going to gather this information, because you are gathering their social security number, just so that they feel comfortable and understand it. And it just helps break the ice and make it where you establish that trust just by having that initial conversation. And that's just very simple. I think we all would do that. Listen actively. Make sure that you're listening. It's easy to pretend you're listening and then not remember what they said at all. And I think we've all done that before where it's kind of awkward. Can you say that again? But ask them to explain the situation, focus on them, ask questions to gather more information so that you're giving them the best answer possible, and then repeat the situation. So you're saying that this happened, okay, or your medications weren't covered at the end of this last year, okay, let's make sure that is taken care of. And I think that naturally happens, but it's just good to point out here. And as you do that, you'll fine tune your response, and I think it would come natural to give an appropriate response, but make sure that, I said it 3 times here by accident, but advice, we don't give advice, we give them objective information. Well, here's what you could do. You could look into this, but this is what most people do. You'll find that people will, then once they realize you're not gonna tell them what to do, they'll say, well, what will you do?
Yeah.
And I sometimes do say, here's what it sounds like, but if this is your situation, and there's a lot to consider. If it were me enrolling in Medicare today, I'd probably do this. I have said that before if they're really pressuring me for it, but for the most part, just guiding them how to gather more information, because it sounds like they're unsure yet. And we do have a lot of great brochures out there to help. Like if they just need to learn more about Medicare, we have just a basic write-up on Medicare, or our website does a good job on diving into the details. And then just ask them at the end. Another good thing to do is at the end, have I done everything you need for today? Make sure you let me know if you have any other questions, and the way to get a hold of you or another volunteer in the area. So some tips. Like I said, this should be pretty quick. Okay, so do not just make assumptions. Ask those clarifying questions, because I'll find myself, if they start giving me a runaround, you quickly start just assuming, okay, I assume they have Part B. Well, find out 2, 3, 5 minutes later in the conversation, oh, you don't even have Medicare Part B, you know, that's where some of those asking those questions will help you from making those assumptions right away, and gathering a little bit more information that might help give or be a better counseling session. I accidentally skipped to this, but body language, you know, having good posture, look interested. Be like,
Smiling.
I don't think it's very common of our generation, but that's common in my generation right here, but not of
You
our
said
more
what?
typical volunteer network. And I think all of our volunteers love what they do. I don't think you'd be doing the work if you didn't enjoy it, if you didn't have some satisfaction, but you have a desire to help them out. That you share the feel, you know, that you're interacting with the feelings that are going on there. Sometimes they're worried, or they're sad, or they're confused, you know, and expressing those feelings and helping them resolve them. You will notice that. Be interactive and asking questions as they're asking, being a good listener, as well as nodding heads. That helps make the conversation go more smoothly. Because number one, when somebody's talking to you about their health, their finances, their insurance, they want to know they can trust you. And these are all ways for them to sense that. And have patience. It's not always easy. Not always easy to have patience, because some people are mandating something or confused, highly medicated. Sometimes some people come to you that are just very highly medicated, in all honesty, and it's hard to get through to them. And patience is necessary. It's not my number one strength, I would always say, but I'm learning it as the more children I have, I guess.
Three more.
With point of view, you know, they're gonna ask you for your point of view occasionally, but try to keep it focused on them. And, you know, here's what I'd look at. If I were you, think about some upcoming health, you know, concerns that you may have. What do you foresee in your next 5 years that could be a potential health concern, you know, that kind of thing, rather than saying what you yourself would think of things. And as you do it year after year or time after time, it always gets easier. So, and I know you all will make great counselors. It's and certainly if you feel uncomfortable with anything, you ask us. Try to have a professionalism and of course respect for that person and their situation. And show that, reflect on things and make sure that you can show that you understand the situation, so that that's another way for them to trust what you're saying. That, you know, reflect upon what they said and show that you understand what they're talking about. And sometimes just telling a story of another, you know, of course without any personal information, but I ran across this situation and here's what they did. It can ease someone's mind a lot. Maybe they have to talk to the clinic about a misbilling. Well, I just talked to somebody and they talked to the clinic, it was no big deal. And if it is, you come back to me and we can go up the chain and resolve this, kind of a thing. But storytelling does help a lot too. You know, with focusing on what learning and having a good phrase of what SHINE really is, that we are an advocacy program where we're not related to any insurance company, that we're there to help beneficiaries, their families, and caregiver. We provide free one-on-one counseling and assistance. All of this helps them understand what we do, what you're here for, that you're a volunteer. People get they really give volunteers a lot of credit too. Just saying you're a volunteer for the program, not paid, you're doing it out of your own free will, and that says a lot too about the mission of the program. Don't say, you know, if, let's say, for instance, what I think of right here is if you wear multiple hats, like let's say you're also a nurse, you know, don't be giving nursing advice, or if you volunteer for doing taxes, you know, let's make a different appointment for the tax consulting, that kind of thing. So if you're wearing other hats and can assist them in other ways, make sure, I would say try to separate them as much as possible, cause we don't want it to look like Shine offers
Tax, right.
tax advice, you know, cause that's really not what our program is. So be careful of those different hats you wear outside of the Shine program. And any topics you're not comfortable with or haven't been trained on, just avoid them, cause like we already said, when you wanna talk the technicalities of it, it's gonna be a harder time proving anything for liability insurance purposes. You know, just stick on what we cover here in training and what you've learned, and you'll be good to go. And a lot of these people are just very confused in general. What you know, even if you feel confused about Medicare, what you've learned already is far beyond what some people coming to you will know. So, you know, just understand you may have to really, I'd start with it as basic as you can and just be like, you know, how familiar with this are you, before you start jumping to conclusions that they understand exactly what every part of Medicare does. Because it is complicated and some people don't want any part of knowing what Medicare is. They want to avoid it as much as possible. And don't say you know it all or shout, you know, that's fraudulent. We always just assume it's an error, I think, for, you know, if somebody does come to you with a billing statement, let's say, you know, the colonoscopy, like I said, that they never did get, but it's on their statement. Let's start by calling the clinic or handing it over to Tom and he can help with that kind of thing. But never come across as you know it all, because I don't know one person even that works for CMS or Medicare itself that would say they knew it all. There's so many. It's so complicated. In addition to this, refrain from, like Dusty said, political or even religious opinions, speaking negatively of Medicare and Medicaid, endorsing any products or services, or jokes that may be considered offensive, and pointing out that you think somebody, a provider in your area could be fraudulent or be malpracticing, just anything, anything opinion-wise that would include, be outside of the scope of, their benefit choices as well. That's really it. Does anybody have questions on counseling? Yep.
Do you have a hold harmless form that you have people sign?
Yes, we do. It's part of that Plan Finder worksheet. So that Plan Finder worksheet we're talking about, where when you're in a counseling session and you have the Medicare beneficiary fill out their name, they also can indicate if they're lower income. It answers all their questions for reporting. On the back, it has where they can sign it. I understand that you are a volunteer and that you are not giving your opinion, and these are my decisions. So we do have a hold harmless
In
form.
practicality, Jamie, I mean,
Yeah.
are people gonna have this form ahead of time coming to see you? Probably not. You're probably gonna have to dig one out. Oh, let's fill this out together.
Yep,
Pretty much. At this
pretty
time.
much every
That
time.
goes. But you want to be sure to get that whole harmless thing
It's
done.
actually confidential.
Yeah,
Yeah.
there's just an area on there, and we don't
Yeah.
mandate, we don't like check everyone, make sure it's been signed. But for your purposes, you know, and a lot of times I even give it back to that person to hold on to, but it would say, yeah, that they understand they're the ones making the decision, and that is an important piece to fill out, yes. I agree.
You're talking about that Medicare D part thing, right?
Part D form. Yeah, it's a form when you're helping somebody. I'll show you a
Yeah.
quick, it's in this resources
More than just
area.
Part D, though.
Yeah, yeah. This would be the information you'd wanna gather on anybody, is this form. It looks like this. Page 240.